Now, Ghana's total confirmed COVID-19 cases have crossed the 100,000 mark as 276 new cases have been recorded. The death toll from the virus has also shot up to 819. And so this is the latest coming from the Ghana Health Service: 276 new cases, 3,560 active cases in all, 819 deaths. And so you have their total confirmed cases since COVID broke out in Ghana, 100,250. Out of that number, 95,871 have been discharged and have also recovered from the disease. Joining me via Zoom now is Seth Ajiman. He is a Deputy Chief Biomedical Scientist at the Korle Bu Teaching Hospital. He's going to give us a lot more insight into this. Thank you very much for joining me here on Midday Live. Does it mean that, as the situation being painted is, if a relative of mine, touch wood, critically falls ill from COVID, he may not get an ICU bed to be admitted on? I think you have to unmute so we could hear you.
Sorry. Good afternoon. Good afternoon to you. Good afternoon to your viewers. It's a privilege to be on this big platform. As you rightly said, our COVID-19 cases, we've hit 100,000. If you go back to 2020, we had our peak somewhere in April, and we started coming down, so we slept. Then we had another peak after the December celebrations. Then we went to sleep. Unfortunately, we get another peak in July. So it looks like it's cyclical: sleep, wake up, sleep, wake up. The numbers have increased, even though it's not as worse as before. But what makes it more worse is that now we have a lot of variants, and these variants have shown higher pathogenicity in terms of transmission rates and the ability of the previous immune response to the previous strain against this new strain. This has led to rising cases of severe and critical cases. So even though the numbers are not alarming, yet the number of patients who are requiring critical management in terms of ICU management is increasing. And if we look at just Greater Accra region, through the work of Ghana Health Service and the National Case Management Team, led by Dr. Feribodi and Dr. Samba, Lee Samba, and Dr. All of them Akaba. There are a lot of hospitals in Accra that have ICU capability, but mainly the GIDC center. But UGMC also had ICU capacity, during the high peak, but currently they are not doing COVID ICU. So we have the capacity in terms of human resource and infrastructure. Maybe the capacity for other resource mobilization that we need, because before we hit this peak in July from June, it was only the GIDC that was receiving patients. And if my memory serves me right, if you go to the Ghana Service website, June, GIDC received just about 8 severe and critical cases. July, the first 2 days, they received about 12 cases. So it means that we are getting people more sick than before.
Okay.
So we have the capacity.
Okay. I think one of the officials of the management team had hinted to us that there probably would be a need at some point for the other facilities, perhaps private individuals, to also avail their ICU facilities to be able to admit some of the cases when they shoot up. Yes.
So if you look at last year, almost all the hospitals mobilized their teams, and most of us were at Ghana East. So we had a lot of human resource, but after the cases started going down, most of the specialists and health workers moved back to their routine working areas. So that is why the leader of the ICU critical cases, Dr. Piso, thinks that all the ICUs in Greater Accra must open their doors, because looking at the trend, whilst we don't see a downward trend and we are seeing an upward trend, it's better prepare for this upward trend, because already workers are tired. Trust me. Almost all of them are tired. Everybody is tired. When you look at their faces, everybody is tired. And when you are tired, trust me, you are going to make mistakes. Even though we are trying to break our back, we have limited time to sleep, have long time to spend in traffic, long distance to cover to our workplaces and to reach patients. And let me also hint here, one of the dangers I'm seeing with these severe critical cases is that most of the testing that are done now, about 90-95% of people who are being tested are people who want to travel.
Okay.
So these are not clinical cases. People who want to travel or people who are entering into the country from other countries.
Okay.
So you can imagine that if we start seeing a lot of people falling sick and going to our routine hospitals who have already laid down their heights and preventive measures that we used to have, where in every hospital entrance they are checking your temperature, they are enforcing you to wash your hands and to wear your mask.
Okay.
And it's very shameful that today people still think that the COVID doesn't exist and it's just a joke.
I'm sure subsequently we'll have a lot more conversation around this, especially heading into the weekend where a lot of activities are expected to happen. Funerals, parties, and other pubs are also going to be operating. The caution is that you adhere to the protocols, especially in the face of a new variant of COVID, which has been found to be deadlier and more clinical when it comes to attacking its victims.